So the most important drugs in obstetrics, it is called oxytocics, not oxytocin. Oxytocin no, oxytocics. So what are oxytocics? This is a small group discussion, right? Not a one way interaction class. I want you all, everybody to interact. তোমরা কত ইন্টারঅ্যাক্ট করবে আমারও মানে একটু সুবিধা হবে। ওকে, হ্যাঁ। So what are oxytocics? Any idea? Huh? Yes, very good. Any drug which cause uterine contraction are called oxytocics. There are three drugs. One is oxytocin, Ergot alkaloids, then prostaglandins. Oxytocin, Ergot derivatives, prostaglandins. These three drugs will cause uterine contraction. প্রথম হচ্ছে অক্সিটোসিন, ওই দিদিটা ভায়াল নিয়ে আসবে, শুরু হচ্ছে। I will tell when the drug is coming. Okay, this drugs will be as a spotter for you. In your final year exams, there will be two tables. One is obstetric table and gynae table. In obs table, they will give you a vial of oxytocin or vial of methylergometrine. Okay, and they will ask, tell me about this drug or describe this drug. Then you will pick up the vial, you will see it, and you will say, even if you don't know the drug, তুমি ড্রাগের নাম তুমি জানো না, আর you can say the drug. See, vial লেখা হবে carboprost, oxytocin. See the drug and you tell the answer. Sir, this is a vial of carboprost. This is a vial of oxytocin. This is an ampule. Sorry, what is the difference between ampule and vial? Anybody? Ampule মানে কি, vial মানে কি? হ্যাঁ, ampuleর একটা মাথা থাকবে. We can break that. Okay, we will break the ampule and withdraw the drug. But vial is not like that. We have to prick and we have to withdraw the drug. One oxytocin ampule, it has 1 ml. 1 ml has 5 units. This is the most important question they will ask for your level. Your guys at third year, right? একটা ভাইলের 1 ml থাকে, 1 ml এর 5 units. Okay, oxytocin is one of the most important hormones in our body. It has two main functions. Anybody tell the two functions? Uterine contraction হয়ে গেল। Next, oxytocin এর কাজ কি? হ্যাঁ, not milk production, milk ejection. There is galactokinesis and galactopoiesis. Galactopoiesis is milk production. Galactokinesis is milk ejection. When mother is feeding a baby, okay, when baby's mouth touches the mother's nipple, there is tactile stimulation. Through the nerve, it goes through hypothalamus. Hypothalamus is stimulated. Okay, তারপর hypothalamus থেকে মানে pituitary, posterior pituitary তে signaling করা হচ্ছে. Okay, there is a touch stimulus by the baby. From posterior pituitary, oxytocin is secreted. This oxytocin will go on myoepithelial cells in breast. Then there is contraction of myoepithelial cells and milk is ejected. This is milk ejection reflex. Okay, that is one. Then uterine contraction. Uterine contraction. So this is brain. Imagine this as brain. Brain इतना खराब नहीं होगा. Okay, this is pituitary. This is hypothalamus. Okay, there is a hypothalamus একটা nucleus আছে. This is called supraoptic nucleus. This will be an MCQ for it. From where is oxytocin secreted? Supraoptic nucleus. Supraoptic. From here, through the axons, it will reach neurohypophysis. What is neurohypophysis? Posterior pituitary. Posterior pituitary, এখানে ইয়ে হয়ে গেছে, রিলিজ হয়ে গেছে, then from posterior pituitary it is secreted. oxytocin. It will go and act on the uterus. Uterus there is receptors. Oxytocin এর জন্য receptors থাকে. There this oxytocin will go and sit. After it sits on the uterus, okay, there will be fundal dominance of uterine contraction. Only this fundus is this region. Okay, the upper part of the uterus, only that are oxytocin acts on that region only. নিচে কোনো কাজ হয় না, নিচে কাজ হয়, there is dilation. Oxytocin causes fundal domination of uterine contraction and cervical dilation, cervical effacement and dilation. So Baba, if baby is there, baby এরম আছে উল্টো, okay, there is fundal contraction is there in fundus, cervix dilate হয়ে যাচ্ছে. So ultimately what will happen? Baby will deliver. Cervix সেখানে আছে তো, no, you guys know what is cervix, right? See, this is an ampule of oxytocin. Okay. See, even if you don't know any answer, you take this vial. When examiner is asking what is this, you just take it in hand. You can see for 1 minute. Oxytocin is লিখা আছে, just পড়তে হবে তোমাকে, sir this is an ampule of oxytocin. Even after that, what is there in this? তার কাছে এখানে লেখা আছে 1 ml. Sir, there is 1 ml. Even if you don't know, নিচে লেখা আছে 5 units. Okay, but you should not be this curious to see. You should know this in your mind. Okay, 1 ml has 5 units. Anybody wants to see? দেখে তাড়াতাড়ি পিছনে দিয়ে দাও. Okay, so ফান্ডাসের একটা কন্ট্রাকশন হচ্ছে. ওকে, একটা জন দেখবে, বাকি সব এখানে দেখো. ফান্ডাল কন্ট্রাকশন হচ্ছে, নিচে ডাইলেশন হচ্ছে. This will promote delivery of the baby. Okay. Mechanism of action, how does it act? So when it comes to this receptor, oxytocin receptor, there is activation of cyclic AMP. This you might have studied in physiology, pathology. Auto deep ami jacchi na. Cyclic AMP is stimulated, then what? There is phosphorylation, ADP phosphorylation, then there is release of calcium ions from the endoplasmic reticulum. This calcium, whenever there is release of calcium ions, there will be smooth muscle contraction. So ekhane smooth muscle ache, that will contract, that is causing the contraction of the uterus. Okay, and remember 2, 3, 4. Okay, T half of oxytocin is 3 to 4 minutes. T half is half life. The duration of action is 20 minutes. Okay, duration of action is 20 minutes. T half is 3 to 4 minutes, which is very less. About one delivery, when patient is undergoing labor, for a primary patient, maximum it can extend till 18-20 hours. Multiparous there will be 12 to 14 hours. She will be in labor. Throughout the time there will be contraction in uterus contraction hoye jabe. Okay, but half life is very 3 to 4 minutes. wo to beshi ye hobe na. Why is it? Because constantly there will be oxytocin supply from the pituitary, but there is an enzyme called oxytocinase. This will degrade. Because of oxytocinase only, the half life is very less. Okay, so when uterine contraction is not adequate, okay, কিছু সময় কি হয় লেবার রুমে, uterus actually should contract, uterus contract করতে হবে. uterine contraction যদি না হলে আমরা কি করি, একটা oxytocin ampule break করে 1 ml we push in 500 ml NS. Straight full ml we don't give, straight as IV we don't give. Every time we mix it with 500 ml normal saline. We push it inside that and then we give a slow IV. Okay, so that there is sustained oxytocin to 2 micro units per hour. Okay, it will go constantly. There will be sustained contractions. If you give in a single shot IV, 3-4 minutes se khatam hoye jabe. So we are giving a slow IV. ওকে, অক্সিটোসিন, তারপর আদার ফরমেশনস কি কি আছে, this is one. Okay, there is another one thing called desamino-oxytocin, sorry, desoxytocin, no, desamino-oxytocin, its half-life is more because oxytocins cannot act on desamino-oxytocin, it is designed that way, it is not degraded by oxytocins, so our half-life basic আছে. Then there is oxytocin nasal form also. Okay, দেখা হয়ে গেছে, এখনো আসেনি. There is one another important role of oxytocin. হ্যাঁ, সেম, ইট অ্যাক্টস ইন দ্য সেম ওয়ে, ইউটেরাইন কন্ট্রাক্ট করছে তার জন্য বিপিএস কন্ট্রোল হচ্ছে. নো আইডিয়া. কন্ট্রাকশন, এই দুটো কাজ বললাম অক্সিটোসিন, মিল্ক ইজেকশন রিফ্লেক্স এন্ড নিউট্রিয়েন্ট কন্ট্রাকশন, এই ছাড়াও কাজ আছে এটা. Yes, it makes you fall in love. Wonderful hormone, ঠিক আছে. So one vial of oxytocin has how much units? 5 units. Okay, ওগুলো তাড়াতাড়ি দেখে পাস করে দাও. So coming to the uses of oxytocin, when will we use oxytocin? Oxytocin has diagnostic and therapeutic. It has diagnostic uses and therapeutic uses. What will you diagnose with oxytocin? This is an important question. Okay, what are the diagnostic uses of oxytocin? One is oxytocin sensitivity test, oxytocin contraction stress test, oxytocin sensitivity test, oxytocin contraction test. Contraction stress test, this is stress test, contraction. Then oxytocin sensitivity, that is one important concept. Okay, এখানে this baby, okay, baby এর একটা প্ল্যাসেন্টা আছে, placenta is connected through the umbilical cord. Whenever there is uterine contraction, uterus যখন contract হবে, the blood supply to the baby is hampered. Uterus contract হয়ে গেলে there is no space for blood to go inside. Okay, so the blood supply of baby is hampered, এখান থেকে blood এখানে baby আসবে না. Okay, so we need adequate contraction and we need break between contraction. Contraction হচ্ছে মানে sustain 1 hour 2 hour 3 hours, constant contraction হলে that is bad for the baby. So there is that certain thing called adequate contraction. So in 10, for a period of 30 minutes there should be 10 contractions, less than 5 contractions, each lasting for 30 to 60 seconds. Okay, this is adequate contraction. When if it is more than that, there will be fetal distress. So in contraction stress test, what we will do, baby কিছু খারাপ থাকলে, if it is a preterm baby or in certain conditions, we do contraction stress testing. We push oxytocin to the mother, falsely induce contractions, and we see if the baby is sustaining the contractions or not, so that we can leave the baby for normal delivery. বুঝতে পেরেছিস? আন্ডারস্টুড? বুঝতে পারছিস না? রেগুলারলি করা হয় না, বিকজ ইট ইজ রিস্ক ফর দ্য বেবি. হ্যাঁ, if I want for example, I want a pregnant mother is there, she is having a RH negative pregnancy. RH negative pregnancy is a high risk pregnancy. Okay, I want her to deliver vaginally. ওকে, সবার মতো ঠিক আছে এসে গেছে সিজার পেট কাটবো এরকম নয়, every mother will see if she's under normally, she's delivering normally or not. Okay, so normal delivery rate of pressure, that pressure baby has to withstand. Okay, so to see if the baby can withstand that pressure, I'm doing this contraction stress test. Ekto oxytocin push kore ami dekhi, there will be contraction, but delivery won't be there. Very little mild dose of oxytocin I will give. Thus there will be contraction. Contraction hoye gele blood supply hamper hoye jacche to the baby, but still the baby is alive. I will see বাইরে একটা CTG বলে cardio tachograph. Okay, with that CTG mission I will see the baby's heart rate, if the baby's heart rate is decreasing or increasing. Okay, if it is decreasing, then I will think, okay, this is bad for the baby, I will not allow the baby for normal delivery, I will do cesarean section. Understood? Samajh gaya? Then oxytocin sensitivity test. This is for the mother, this is for the baby, this is for the mother. I will give oxytocin and see if the uterus is contracting. If uterus is sensitive to oxytocin, uterus will contract. Okay, these are the diagnostic uses. Therapeutic uses. Tell me, আমি কথা বলে যাচ্ছি. When will we use oxytocin? Yes, we induce labor. What is it called? It is called induction. We use in induction and augmentation. Augmentation means what? What is augmentation? To increase the speed. Normally, if I want to deliver any baby fastly, if for example, if there is a mother with heart disease, okay, this whole labor process is risk for her. At that time, I want to cut short the second stage of labor. I want to deliver it fastly. That time, what I will do, I will give oxytocin for the baby, and there will be more contraction, so the baby will be delivered very fastly. That is cut shorting of second stage of labor. This is called augmentation. So labor plus, if I want to speed the process, that is called augmentation. Oxytocin used for induction, both to start the contraction and to augment the process of labor. Induction and augmentation. Okay, then yes, stop PPS. What is AMTSL? AMTSL, active management of third stage of labor. 4 points, every point is an MCQ. 4 points. ठीक है सर. First is oxytocin. Oxytocin 10 units. Not only oxytocin, you can give any uterotonics. Next I will tell that. Okay, but oxytocin is the main. Oxytocin 10 units IM. These 4 points you remember. Baby deliver hoye gale, third stage of labor. What is third stage of labor? First stage jano? Anybody? First stage. What is first stage? Oh, acha. There are 3 stages. Okay, for at your level I will tell. There are 3 stages of labor. তোমাকে আবার জিজ্ঞেস করব. There are 3 stages of labor. Okay, stage 1, stage 2, stage 3. Starting from the point of uterine contraction. Uterine contraction যখন শুরু হচ্ছে to full dilation of cervix. Maximum cervix will dilate till 10 centimeter. Okay, we will insert our finger and see through the baby mother's vagina and see if the cervix is dilated or not. The baby's head can accommodate, can come down or not. Okay, we say 10 centimeters. If there is 10 centimeters, we say this full dilation. Okay, contraction शुरू होएगा, then fully dilated होइसे कि ना. This is first stage, from contraction to full dilation of cervix. From full dilation to delivery of baby, the second stage. After delivery of baby, what will happen? There will be delivery of placenta. So baby to placenta. This is third stage. बुझे गली? बोल आবার. हाँ. हाँ. After the delivery of baby, there will be 30 minutes. Within the 30 minutes, there will be delivery of placenta. So this third stage, we call it AMTSL, active management of third stage of labor. After delivery of baby, we give AMTSL to prevent PPH. This is a very important step. If you don't do this, mother will have PPH and she will die. Active management of third stage of labor. আমার এই প্রবলেম হচ্ছে active management of third stage delivery পরে after the delivery of baby তো baby delivery হয়ে গেছে from baby's delivery to delivery of placenta, within that time we have to do AMTSL. Oxytocin 10 units, controlled contraction, CCT, controlled contraction. So after the baby's delivery, we will remove the placenta. Placenta ke hatat kore you should not pull, or you can't wait. Acha ঠিক আছে, time হয়ে যাবে, ভিতরেই থাকবে. You should do gentle traction. Placenta এখানে attach হয়েছে, ঠিক আছে, cord বাইরে চলে আসবে. You are standing outside. You will pull the cord. Mother's pubic symphysis এখানে এর উপরে হাত দিয়ে তুমি gentle traction করবে. Gently push the pubis uterus up and placenta will deliver like this. If there is any normal delivery, you should go to labor room and see, then only you will understand. This is called modified Brand-Andrew technique. Modified Brand-Andrew technique, this we call as control contraction. Understood? Brand-Andrews, BRANDT. আমি যা যা বলছি সব কিছু এমসিকিউ. কন্ট্রোলড কন্ট্রাকশন, প্লাসেন্টাল মানে কন্ট্রাকশন, কন্ট্রোলড কন্ট্রাকশন. control contraction. LCS, this is only for normal delivery. Okay. Then delayed cord clamping. Delayed cord, please bear my handwriting. Third is intermittent uterine tone assessment. মাঝে মাঝে হাত ইউট্রাসের হাত দিয়ে you will see if uterus is contracted or not. If uterus is non-contracted, there will be atonic PPS. Tone হবে না, then there will be PPS. If any time if you don't understand, you stop me. ये class আবার হবে না. Okay, it's very important. Intermediate uterine tone assessment. Intermediate uterine tone assessment. This is delayed cord clamping. বাচ্চা বেরিয়ে গেছে, ঠিক আছে, it's not তাড়াতাড়ি মানে কর্ডটা কেটে দিই. You should wait for 1 to 2 minutes so that the last pinch of blood also it will come to the baby. We can save that also. তাড়াতাড়ি কাট হয়ে গেলে রক্ত নষ্ট হয়ে যাবে না. We'll wait. Baby will have in mother's hand. Okay. We'll wait for 1 or 2 minutes. Then we'll cut the cord. Then we will hand over the baby to the mother. Understood? বলো, ঘুম পাচ্ছে? হ্যাঁ হ্যাঁ বলো, AMTSL কি কি আছে বলো. 10 units IM, not IV. ওকে, হ্যাঁ তাড়াতাড়ি বলো. নেক্সট আর দুটো ড্রাগ আছে. হ্যাঁ, yes, delayed cord clamping. Huh? Do 1 or 2 minutes. 1 to 2 minutes you can wait. So in AMTSL, if patient is having PPH, patient এর যদি bleeding হচ্ছে, okay, কিছু কিছু সময় কি হয়, uterine contraction হয় না after delivery. If uterus is not contracted, প্রচুর bleeding হয়. Okay, normally for vaginal delivery there should be minimum 500 ml blood loss. If it is more than 500 ml blood loss, we call it PPS. For cesarean section, more than 1 liter blood loss, we call it PPS. Okay, so when we see আমি ডেলিভারি করেছি, বেবি ডেলিভারি হয়ে গেছে, ওকে 200-300 ml is fine, আমি দেখছি মানে ব্লিডিং হয়ে যাচ্ছে, okay, more than 500 ml, then I should assess there is PPS. Then I will give extra oxytocin. Then oxytocin I will give another 20 units. If PPS, we should give 20 units. এখানে AMTSL 10 units দিচ্ছি, PPS 20 units. তোমাদের রেজাল্ট এসে গেছে না? How many of them passed? 150 batch.
150 batch.
Okay, I will tell few contraindications. Okay, and we'll go to next trend. না হলে বোরিং হয়ে যাবে. Okay, every drug you তিনটে uses, তিনটে contraindications, side effects. Just know this. Okay, in which patient oxytocin আমরা দেব না. Okay, if there is any previous cesarean section, already patient এর সিজার একটা হয়েছে বা কিছু মায়োমেক্টমি হয়েছে, ইউট্রাইন অপারেশন হয়েছে, for that patient we will not give oxytocin because that contract already একটা scar আছে ইউট্রাসে. if again the uterus contracts, uterine rupture হয়ে যাবে. see, when we do cesarean section, এখানে একটা পেট খাটা থাকবে ইউট্রাসে, we incise here and deliver the baby. Next time when it heals, the thickness will be less. Here if you cut and see, the thickness will be 1 centimeter. Here it will be just 0.5. Okay, so when we give oxytocin, there will be ineffective contraction, so this area will rupture. Okay, that is one contraindication. Cephalopelvic disproportion. What is CPD? Cephalopelvic disproportion. Previous uterine scar, any history of previous cesarean section, uterus এর কোনো scar থাকলে, ঠিক আছে? হ্যাঁ, cephalopelvic disproportion. Cephalopelvic disproportion. Cephalom is baby's head, pelvis is mother's. Okay, এই দুটো disproportion হয়ে গেলে, if the pelvis is too short or if the baby's head is too big, baby will not come down, delivery হবে না বাচ্চাটা, আমরা ফালতু অক্সিটোসিন দিয়ে কি লাভ, কিছু হবে না, baby will not deliver. Okay, that is one indication. And malpresentation. What is malpresentation? Yes, breech presentation is a malpresentation. If baby's head is here and baby's buttock is here, or baby's head is here, this is transverse line. Okay, in this condition we can't give oxytocin. Baby's head is not here, no. For cervix to stretch, baby's head should be there down. Baby's head, if it is not down, the cervix will not be stretched, it can't be dilated properly, so that is a contraindication. And one, what is grand multipara? Kotobar. What is multipara? What is grand multipara? More than 4. Sure. কোন নাম? দেবলি নাম বলেছেন? আমি যত how much I know, it is more than 4. Okay, 5 it is very rare. Grand multipara is more than or equal to 4 babies. Multipara is more than or equal to 2. What is multigravida then? What is multipara? What is multigravida? না, জোরে বলো. হ্যাঁ, okay, correct somewhat, but multigravida means she had conceived more or 2 times before, but the baby might have crossed the period of viability or not. It might have got aborted also, but multipara means 2 babies have crossed the period of viability. Okay, so in grand multipara uterus will be very thinned out, 4 time delivery হয়ে গেছে, okay, uterine strength ই থাকবে না, in that if you give oxytocin ফেটে যাবে, there will be uterine rupture. Okay, side effects. Oxytocin, any oxytocin you should not give as IV bolus. What is IV? মানে straight IV you should not give any time. Why? There are two side effects. There will be sudden hypotension for the patient. Okay, sudden hypotension and water retention. So every time I told you oxytocin we mix with normal saline and put in IV drip. Straight IV we don't give. Apart from this, coma, convulsion, MI, these are the side effects. Okay, oxytocin হয়ে গেল. Shall we go to next drug? Boring লাগছে কো? ঘুম পাচ্ছে না? হ্যাঁ হ্যাঁ একই জায়গায় করবো, মানে একটু এদিক ওদিক হতে পারে, সার্জনস প্রেফারেন্স, আই ডু ইট অন দ্য সেম সাইড. Okay, first is oxytocin, next is ergot ergot derivatives. Okay, that one drug is Methylergometrine. We use Methylergometrine or Ergometrine. Okay, সব মানে ড্রাগের ডোসেজ মনে করতে হবে. Ergometrine, Methylergometrine. Okay, then carboprost আমি এখানে বলছি, just know the dose. Carboprost, it is a prostaglandin, we will see it next. Okay, the dose of carboprost is 250 microgram. The dose of methylergometrine, what we use here, it is 0.2 milligram. It is 0.25 milligram. এই তিনটে ডোজ you have to know. তারপর oxytocin. Okay, these two are derived from ergot alkaloids. Ergot alkaloids are derived from a fungus called Claviceps purpura. Cereal se thake Claviceps purpura. Okay, from that fungus we get this. Okay, like unlike oxytocin, methylergometrine, okay, কি করে ইউট্রাসের সাস্টেইন কন্ট্রাকশন করে. Okay, oxytocin gives space, t half is 2 to 3 minutes only, but here it will give sustained contraction, constantly it will contract the uterus, so we don't use this for induction and augmentation. Okay, we use methylergometrine only to prevent PPH and to treat PPH. বুঝে গেল? Understood? So it can be used in this place also. Instead of oxytocin, if we don't have oxytocin, we can use methylergometrine in AMTSL to prevent PPH, okay, and to treat PPH also. So one vial has 1 ml. Where is this? আমি দেখছি 1 ml. Okay, 1 ml has 0.2 milligram. Okay, maximum you can give 5 doses. Bleeding বন্ধ না হলে you will wait for 30 minutes and then you can repeat. You can wait for 10 minutes and then you can repeat. Like this, 0.2 milligram you can give maximum 5 doses. Okay. Two important side effects of methylergometrine. Okay, আমরা লেবার রুমে নরমালি তিনটে ড্রাগ ইউজ করি, অক্সিটোসিন, মেথডজিন, কার্বোপ্রস্ট, এই তিন ছাড়া তারপর মিসোপ্রস্টাল থাকে. ওকে, দিস 3-4 drugs we use constantly for every patient, but before giving methadone we ask history, 1-2 important history to the patient. Okay, if she is having any hypertensive disease or not, if she is having any heart disease or not, if she is having heart disease or preeclampsia, eclampsia, it is contraindicated, we can't use in that patient. What is preeclampsia? হ্যাঁ not করছিস. If you don't understand you tell me, I will tell. Simple, এখানে কোনো লজ্জার কিছু নেই, আমরা জাস্ট গ্রুপ ডিসকাশন করছি. হ্যাঁ বলো, if you know you tell, otherwise you say. Hypertension in pregnancy, আমি কি জিজ্ঞেস করলাম? হ্যাঁ, hypertensive disorders or pregnancy, there are 4 types, 4 sub classification: preeclampsia, eclampsia, eclampsia superimposed on preeclampsia, chronic hypertension. Okay, what you told is okay, somewhat okay. Okay, eclampsia মানে পেশেন্টের কনভালশন হবে, এগুলো অন্য ক্লাসে আমরা যাই, না হলে অনেক ডিপ হয়ে যাবে. What you told is fine. Okay, BP will be more in that patients. So if you give methodzin, because of the uterine contraction, sustained uterine contraction হলে কি হবে, the blood from the uterus is distributed to the venous circulation, so the venous return to heart is increased. Understood? Venous return heart এর increase হয়ে গেলে there will be CF, heart failure. বুঝা গেল? Understood? Any doubts? See, when there is blood supply in uterus, okay, when uterus contract হয়ে গেলে blood গুলো এদিকে উল্টো দিকে যাবে, উল্টো direction. So from here it will go to heart, IVC. Okay, so the venous, that we call as venous return to heart is increased. It will cause overload in heart, that will lead to failure. I'm telling about the side effect, why there is hypertension, why patient can have, heart disease patients are contraindicated for given methylergometrine. Okay, next is prostaglandin. This is a, what is this? This is a vial of carboprost. Okay, one vial has, see how much does it have, 250 microgram. কত ml আছে? Okay, so 1 ml has 250 microgram. See, our basic সময় নেব না. Okay, just 10-15 minutes I will finish the class. Prostaglandins though you are reading from first year only. Okay, how is the prostaglandin synthesis from arachidonic acid, from Cox pathway, hand tan, that you know already. Okay, the most important prostaglandins in obstetrics I will tell: PGE1, PGE2, PGF2 alpha. Okay, PGE1 misoprostol, C1, this is 1. PGE2 we also call it as dinoproston. See, di2. Okay, then F2 alpha is carboprost. Okay, normally the uterus, the endometrium, okay, see, this is the endometrium. This part we call it as deciduum. This deciduum normally has prostaglandin. This amniotic fluid, that has prostaglandin. Okay, and menstrual blood. Okay, menstrual blood also has prostaglandin. This prostaglandin, what it does, it causes smooth muscle contraction. So when you are having menstruation, because of the prostaglandin synthesis, there will be contraction of uterus. That is why females have pain during menstruation, because of the prostaglandin synthesis. Okay, apart from that, is a amniotic membrane. Okay, when there is any rupture, a membrane jodi rupture hoye gale, there will be prostaglandin release. Then if the baby is miscarriage, what we say, okay, if there is any problem with the placental attachment, there will be hampering of decidua, that will also cause release of prostaglandins. Why I am saying this? Because this prostaglandin F2 alpha is present in the decidua and amniotic fluid. What F2 alpha does, it causes contraction. uterine contraction. Okay, what this E2 does? E. You say E, your mouth will get dilated. है ना? E. Dilate होচ্ছে. So this will cause cervical dilation and effacement. E for effacement. This causes cervical effacement and cervical dilation. F2 causes contraction. Okay, so coroprost we give for what? To prevent PPH. We want the uterus to contract in some places, so we give to prevent PPH. And in treatment of PPH, dinoproston we give, what is that called? Induction of labor. Okay, so this we give in induction of labor as gel form. That gel is not available here. Okay, this is misoprostol. Misoprostol is tablet. We use this in induction, augmentation, and also PPH. Misoprostol, what it does? Both E1 and E2. It causes cervical dilation and effacement. Both E. Okay. For example, I will tell you. Say we are doing a hysteroscope for a patient. What is hysteroscopy? You know laparoscopy? We give a port inside and we see inside the abdomen. Likewise, hysteroscopy, what we do? We give a port inside the uterus and we see. Most of the patients, what happens? The cervix, no, it is closed. So what we do the previous night, we give 100 or 200 misoprostol per vaginally. So the cervix becomes soft. Then it is easy for us to introduce this cannula, the hysteroscope. Otherwise, it is very difficult. In conditions where you want to do dilation and curettage, if there is any abortion, okay, see if there is any abortion, there is bleeding inside, okay, you will have to terminate the pregnancy. You have to wash korte hobe, but cervix to bond hoche. What will you do? You will give misoprostol and you will prime the cervix. Cervix একটু soft হয়ে যাবে, তারপর you will insert the curettage and take out the products. Understood? So we use misoprostol in normal induction also. I told for oxytocin, we mix it 100 ml NS, we mix 5 units oxytocin and put it in slow IV drip. 2 micro international units per minute we start for induction. Misoprostol, what we do? Misoprostol tablets are ekhane likha nahi, but in exam see it is written. Even if tablet, if they see what is this tablet, you take the tablet and read the name. Misoprostol. Sir, this is a misoprostol strip, 200 microgram. Okay. For induction, we give 25 to 50 microgram of misoprostol per misoprostol tablet can be taken orally, perrectally, vaginally, sublingually. Okay, any forms you can give. 25 to 50 microgram you will give per vaginally every 3 to 4 hours. 4 doses you will repeat. Okay, likewise we will give. But there is one important side effect of misoprostol. Okay, one, it causes hyperstimulation. It is a prostaglandin. Okay, so it is also like methylation. Constantly it will contract the uterus, and the uterine contraction is so vigorous that we call it as hyperstimulation, that it hampers the blood supply of the baby. Okay, hyperstimulation. If that is persistent, then that will cause meconium stain liquor. Meconium. What is meconium? MSL. Meconium stain liquor. Baby will pass its the first excreta, stool of the baby, we call it as meconium. Okay, you know uterus, the baby is there, the baby will drink, the baby will urinate. Okay, and it will drink the amniotic fluid. The amniotic fluid will go inside the mouth, inside the nose, inside the respiratory tract, lungs, everywhere the amniotic fluid will go. But when it passes the stool, meconium, that will also go inside. Okay, that is not a clear fluid. Okay, because of MSL it is dark green color. First stool of the baby is very dark green color. Okay, so if we doubt for MSL, no, we do rupture the ARM, we do PV, we rupture amniotic fluid, we see the color of the amniotic fluid. If it is green, then we think okay, this is MSL. If MSL, taratari amra mane scissor kori usually. We don't let it for normal delivery. Why? Because if that meconium stain liquor, if it goes inside the baby's lungs, okay, there is no way it is coming back. It will lead to hyaline membrane disease. Hyaline membrane disease of the newborn is caused by meconium stain liquor. Why baby will pass? Any idea? পেটের ভিতরে বেবি কেন meconium পাস করবে? Any idea? Can you? হ্যাঁ, idea আছে কিছু? Why will it pass stool inside the womb? Okay, which nervous system supplies our gut? Celiac. See, that is not that detailed. Parasympathetic system. Okay, parasympathetic system. Okay, when baby is in distress, his heart rate varies. That will cause stimulation of the parasympathetic system. Because of parasympathetic nerve stimulation, there is dilation of the anal sphincter of the baby. তার জন্য meconium pass হচ্ছে. Okay, this is a side effect of misoprostol. ये तो है আমি বলেছি story is to tell the side effect of misoprostol. Misoprostol side effect is that one: meconium stain liquor, hyperstimulation, and uterine rupture. Okay, then dinoprostone gel, it is available in gel form. It will have a long stylet, then a cartridge. Okay, then we will push it inside the vagina. There is gel inside. Okay, 2.5 ml, 0.5 milligram, 0.5 milligram dose, 2.5 ml is the quantity. We push 2.5 ml in the posterior fornix. This is cervix, this is vagina. We push it here. This will cause softening of the cervix and cervical dilation, induction and augmentation. Okay, তারপর কর্বোপ্লাস্ট হয়ে গেল. Okay, so side effect: before using any prostaglandin, we should see if the mother is having asthma or not. Okay, because prostaglandin F2 alpha, it causes bronchoconstriction. So we should take bronchial asthma history, any cardiac disease history, or if she is having any renal disease or not, because this drug is excreted renally. Okay.